venous thrombosis. It is also called DVT. It is the clotting of blood in the profound veins of the calf, thighs, or pelvis. What are the different predisposing factors for deep venous thrombosis? There are many. We will talk about some of them. 1. An age of more than 60 years. 2. Cancer. 3. Heart failure. 4. Smoking. 5. Estrogen receptor modulators. 6. Contraceptive or estrogen therapy. 7. Hypercoagulability syndromes. 8. Immobilization. 9. Trauma. 10. IV catheter. 11. Hyperviscosity due to myeloproliferative disorders. 12. Nephrotic syndrome. 13. Pregnancy or postpartum. 14. Sickle cell anemia. 15. A previous pulmonary embolism or DVT. 16. Surgery in the past 3 months. What about the clinical picture that you can see on a patient with DVT, deep venous thrombosis? She is asymptomatic. 2. Pain is tender in the calf along with the vein trajectory. 3. A swelling more than 3 centimeters difference in calf diameter, 10 centimeters below the tibial tuberosity. Homan sign, which is the pain in the calf when flexing the foot on the leg. Edema, which is hardly pitting. These are the characteristics of the edema seen in a patient with DVT. It is hard pitting, cold and painful. Visible dilated collateral veins. Phlegmatia alba dolens, important edema, milky white and in pregnancy. Edema obstruct capillary film. Phlegmatia ceruleus dolens is an important edema which is cyanotic by massive occlusion of the iliofemoral vein, and venous and arterial stasis takes place in the affected limb. What about talking about the complications of the DVT, deep venous thrombosis? 1. Pulmonary embolism, and this complication can occur in 5% of the DVT patients. If the pulmonary embolism is left untreated, determines a fatal pulmonary embolism. Number 2, for the complication, a recurrent DVT, low risk if the predisposing factors are transitory, high risk for idiopathic DVT or when cancer, heart failure, or proximal or resonant thrombosis, etc. occur. 3. A risk for venous insufficiency, which is unknown. Note that the screening of all patients with DVT for cancer is irrelevant. Screen only for the ones that do not have an obvious cause or have suggestive history. What is venous insufficiency? Venous insufficiency, it is symptomatic, impaired venous return, either as initial event or after DVT, post-thrombotic syndrome. What are the different causes of venous insufficiency? These causes include venous hypertension, which is increased pressure. What about the risk factors for venous insufficiency? These include trauma, age, obesity. Talking about the determinants of venous insufficiency are right heart failure, increased intra-abdominal pressure, like pregnancy, ascites. 3. Compression in terms of abdominal or pelvic neoplasia. What is the clinical picture seen on a patient with venous insufficiency? The symptoms include a sense of fullness, heaviness, tiredness, aching, cramps, pain, paresthesia in the legs, and pruritus. Note that pruritus worsen with standing or walking and are relieved by rest and elevation. There are different classes in venous insufficiency. Class 0, the signs, there are no signs of venous disease. Class 1, reticular veins. Class 2, varicose veins. Class 3, edema. Class 4, skin changes, induration and depigmentation. Class 5, skin changes, secondary to ulcer healing. Class 6, skin changes and active ulcer. What is superficial thrombophlebitis? The signs that you can see, inflammatory signs like erythema, edema, pain. palpable superficial vein which is linear, red, hot and very painful. Don't necessitate anticoagulation. Superficial thrombophlebitis heals in a period of 5 to 7 days, eventually with local heparin. Thank you for watching and looking forward to see you in the next video.